And kids are out of school, but that doesn't change the access to health care that many Utahns rely on at Intermountain School Health Clinics. Shireen Gorbani, the Community Health Director for Intermountain Health, joining me now to talk more about clinics staying open in the sponsored interview. And if Shireen looks familiar, she has been the Salt Lake County Council member formerly, and now you've gone to the health side, and this is a passion for you.
Yes, that's right. So access to healthcare, we know, is critical for healthy families, healthy communities. So Intermountain Health is so grateful to be a partner with Salt Lake City School District to have two really community-based clinics set in schools in Rose Park and in Liberty Elementary.
School is out, but we didn't want to have a gap in health care.
That's right.
Why is this so important to make sure families who are underserved get treated?
Yes. So we know that just access to regular checkups is such a great way for people to maintain their health. And these are really clinics where people can go in and get primary care. They can get access to a doctor. They can work on managing a condition if they have it. But it is really important, as you mentioned, though school is closed, the clinics remain open.
And why these locations in these parts of the community?
Yeah, so we know that across Utah, there's great disparity where we have communities where there are high rates of individuals who are uninsured or underinsured, and other places where we have pretty good coverage rates. Both of these clinics are embedded in communities where we know people lack access to health care, often because they lack coverage. And so it's really important to the mission of Intermountain Health that everybody, regardless of their ability to pay, has access to a clinic where they can receive care.
What would you like to tell people who are underserved or who need this access? I know during the school, it's easy, it's there, but you want to tell people that it continues to be open.
Yeah.
Right? Who is this for?
Yeah, so this is the interesting thing. Even though they are based in schools, the vast majority of people who access these clinics are between the ages of like 18 and 60. So these clinics can serve absolutely everyone. A child can get a well child check in these environments. You can come in and manage, as I mentioned, diabetes or an ongoing chronic condition can receive care in these clinics. And then it's also a way to get connected to, if you need additional screening, if you need connection to behavioral health services, whatever. This is a great entry point, as are community clinics across the entire state, right? So that is the place where you can go, you can get connected to health care, and there are many facilities, clinics across the entire state that can help people really regardless of their ability to pay. But one of the things, I've mentioned this before in conversations we've had, but I grew up uninsured. My mom worked in a school that didn't offer insurance, or she couldn't afford it. And access to community-based clinics like this was exactly how I got treated for earaches, got my well child checks, got in to make sure, basic vision screening, all those kind of basic things that happen in a kid's life, those can happen in these kinds of clinics.
And look at you now.
And look at me now.
I mean, that just is a true testament of how big of a difference this can make in families, their lives, and their future as well. Because as we know, education and health go hand in hand.
Yeah, that's right.
So let's talk about what people can see. Is the screenings?
Yeah, so these are just really basic points of care. So you can come in, you can schedule an appointment with a doctor, you can get a basic checkup. It's also a place, as I mentioned, where if you have a chronic illness, asthma, something that needs management, you can get that care there as well. So these are just really wonderful, vibrant, small clinics, but they're easy to get into, and you can certainly call, visit, intermountainhealth.org to be able to find the hours and the exact locations, but they are, as I mentioned, in Rose Park and in Liberty Elementary. And they're really accessible community centers where people can come and get care.
And I'm sure you've seen great success out of this.
So we have, and a big part of that too, I think, is really just the dedication that our caregivers have to the community. Individuals that are from Rose Park that are able to serve right there in Rose Park, they know their neighbors, they're a welcoming face, and they're also a place where we can provide services in Spanish as well, which we know is important too. Sometimes people stay out of care because of language barriers, many barriers really to health care, but these are really accessible, they're really fun spaces with incredible caregivers who are ready to serve.
And they can just walk in as well,
They can walk in as well, though we definitely suggest, if you don't want to experience a longer wait, go ahead and call that number and get an appointment scheduled.
Excellent. Those two locations one more time.
Yes, so they are embedded in Rose Park Elementary and in Liberty Elementary in Salt Lake City.
Shireen, thank you so much. For more information, you can always head to intermountainhealth.org.
Thanks for having me.
And thank you to Intermountain Health for sponsoring this interview.